What methods help collect sputum samples from children for TB testing? Getting a sputum sample from a child for tuberculosis testing can be tricky because young kids often can't cough up sputum on their own. To help with this, healthcare providers use several safe and effective methods. One common approach is sputum induction. In this procedure, the child breathes in a mist of a special saline solution, usually 3% sodium chloride, through a mask or mouthpiece for about 5 to 15 minutes. This saline helps loosen mucus in the airways, making it easier for the child to cough up sputum. After inhaling the saline, the child is encouraged to cough and spit the sputum into a sterile container. Sputum induction is widely used because it is safe, well-tolerated, and can be done in outpatient clinics or hospitals. It has shown good results in collecting samples that can be tested for tuberculosis bacteria. Another method is gastric aspiration, also called gastric lavage. Since young children often swallow sputum containing bacteria, the bacteria can be found in the stomach. To collect this, a thin tube called a nasogastric tube is inserted through the nose into the stomach early in the morning before the child eats or drinks. The healthcare worker then gently withdraws stomach contents, which may contain tuberculosis bacteria. This sample is tested using laboratory methods like molecular tests or cultures. Gastric aspiration is especially useful for very young children who cannot produce sputum on their own and is a standard method in many settings. It does requiring trained staff and special equipment but is effective in diagnosing TB. In some cases, especially when other methods do not provide clear results, doctors may perform bronchoscopy. This is a more invasive procedure where a thin tube called a bronchoscope is inserted into the airways under sedation. It allows direct collection of samples from deep within the lungs, called bronchoalveolar lavage. While this method provides very accurate samples, it is usually reserved for complicated cases because it needs specialized equipment and trained specialists. To improve the chances of detecting tuberculosis, healthcare providers often collect more than one sample, usually 2 or 3, taken on different days, often early in the morning. This increases the likelihood of catching bacteria that might be present in low numbers. It is also important that all procedures follow strict infection control measures to prevent the spread of tuberculosis to healthcare workers or others. Proper ventilation, protective masks, and isolation rooms are used during sample collection. In summary, the main methods for collecting sputum or respiratory samples from children are sputum induction and gastric aspiration. Bronchoscopy is used in special cases. Collecting multiple samples over several days helps improve diagnostic accuracy. Always remember, these procedures should be performed by trained healthcare professionals, and anyone suspecting TB should consult their doctor for personalized advice.